Good afternoon, and welcome to another Research in Action brought to you by the Division of Research at Florida Atlantic University. My name is Karen Scapinato. I will be moderating today's session. Before we get started, I want to go over a few logistical items. Because of the number of attendees, we cannot allow you to talk and ask your question in person. So we ask that you type your questions on the Q&A button at the bottom of your screen. If you hover your mouse there, you find a Q&A icon. If you click on that, a little pop-up comes up and you can type your question there. You can type your question at any given time during the presentation, and we will come to and answering them at the end of the presentation today. With that, it is my great pleasure to introduce today's speaker, Dr. Justin Bernstein. Dr. Bernstein is an assistant professor in the Department of Philosophy at Florida Atlantic University. He received his BA in philosophy from Vassar College, then went on to receive an MA in philosophy from the University of Wisconsin at Milwaukee, and a PhD in philosophy from the University of Pennsylvania. He then did a postdoc at Johns Hopkins before coming to FAU, where he is now. Dr. Bernstein has extensively published, and I think he's going to tell you himself what he's researching at the moment.
All right. Well, thanks so much, Karen, for that generous introduction, and thanks for having me. I'm happy to be here. So I'm going to go ahead and get going. So first, I have no conflicts of interest disclosed. I'm not in the pocket of big pharma or anything like that. What I want to do is I want to talk about three different topics. This is partly because I couldn't quite decide which one of these three to talk about, but also I figured it might be interesting to sort of get a tasting menu of different sorts of topics in the ethics of vaccination. So the first topic I'm going to talk about is the issue of allocation of vaccines and priority setting. So more specifically, how should governments allocate vaccine during a pandemic, and who should get first access to a vaccine when there's not enough to go around? The second sort of question I'll think about is about the obligations, the moral obligations of individuals to get vaccinated against COVID-19, and whether in fact there is an obligation to do so. And then finally, I will turn to questions about mandates, and I'll ask really specifically whether healthcare workers should be subject to vaccine mandates. So I think it's worth clarifying it's striking when you look at those three different topics, like how are these all about vaccines? And I think that there's a sort of interesting diverse array of topics when it comes to the ethics of vaccination. So on the one hand, there are questions about how do we allocate vaccines that arise because vaccines are a really valuable resource. So people want vaccines, especially during a pandemic, and there's not enough to go around. In other words, demand currently outstrips supply. So in this sense, questions about the ethics of vaccination can be viewed as somewhat similar to questions we were dealing with in the spring, like if we don't have enough ventilators, who should get a ventilator first? Or if we have too many patients in hospital beds, who do we prioritize to get medical care? On the other hand, sometimes people think about vaccines, they think about mandates, or whether it's the government telling you what to do with your body or your child's body. And some empirical work that surveyed people's attitudes about a COVID-19 vaccine mandate found that far less than the majority of people think that mandates are appropriate or acceptable, either for all adults or even employer-enforced mandates. Now, this was back in December. Maybe attitudes have changed. People's attitudes about the COVID-19 vaccine are very fluid, but it's striking nonetheless that on the one hand, you have this debate about who should get a vaccine first. On the other hand, it's does the government have the right to require people to get this very beneficial medical intervention? And what I want to emphasize here before I get going in earnest is that the different functions of vaccines correspond to different issues in the ethics of vaccination. So on the one hand, vaccines protect the recipient. And when we have a scarcity of vaccine, when demand outstrips supply, that leads to questions of justice. Lots of people want to be protected individually. how do we decide who gets protected first? This is a standard sort of allocation question you see in bioethics with any valuable medical resource. On the other hand, vaccines protect other people, and they even protect populations. Because vaccines can protect other people, this leads to questions about whether individuals are obligated to get vaccinated. And because vaccines can protect populations, governments have a real incentive to try to get as many people vaccinated as possible, including by mandating vaccines or basically requiring people to get vaccinated or to have their children vaccinated. That leads to questions about individual liberty versus the common good and legitimacy. So I was part of a group that looked at how, in the summer of 2020, we were meeting, it was me, various epidemiologists, some vaccine safety experts, sociologists, anthropologists, a variety of people were all in the room debating how should we allocate the first batch of vaccine when it gets developed. And we sort of settled on a couple of distinct values: minimizing risk of severe illness or death, promoting social utility, and mitigating injustice. And I'll talk about each of these. So first, we might think that vaccines, as mentioned, they protect recipients. And so a really natural thought would be that we should allocate vaccines in a way that protect as many people as possible, especially people who are at severe risk from COVID-19. So people over the age of 65 are at much higher risk than younger age groups. And people with various underlying conditions like diabetes or high blood pressure are at higher risk than people without those conditions. And so a really natural thought would be that we should just prioritize people who are older or people who have these sorts of medical conditions, because doing so will save the most lives or prevent the most cases of severe illness. A second thought, however, is that vaccines enable us to sort of get back to normal. So because vaccines provide protection for individuals, it makes it safer for them to go back to work. And so vaccines have this ability, by keeping essential workers safe, to promote social utility. So most obviously, this comes in the form of protecting healthcare workers. So healthcare workers can go to work and rest assured that they're safe if they've been vaccinated. But also there are other sort of essential workers in society who are integral to the smooth functioning. So for instance, grocery store workers, they're at high risk of contracting COVID. And we might think that one way to promote social utility would be to ensure that they stay healthy, or the same for sanitation workers or teachers, a host of people who all sort of help society regardless of this pandemic. Finally, we thought about the value of justice. So this pandemic has not affected all people equally. So for one thing, if you look at the bottom left, this is sort of displays how many people are able to work at home during the pandemic. So shuttering non-essential businesses and calling for people to work from home, that's pretty doable for the top quartile in terms of income. And it's, people from the bottom quartile of income are not able to work from home. So in other words, various measures we've taken to mitigate the effects of the pandemic have been far more burdensome on some of the least advantaged members of society than on the most advantaged members of society. Similarly, there are striking differences in terms of mortality rates between different ethnic and racial groups. Presumably, this is unfair, it's unjust. And so one natural thought would be, we can allocate vaccines in a way to sort of make up for the unfair distribution of burdens during this pandemic. So if we try to allocate vaccines in a way that target people from less well-off backgrounds or people from ethnic or racial groups that are especially disadvantaged, perhaps that could mitigate some of the injustices of the pandemic. So we ultimately arrived at a couple of different sorts of candidates for tier one prioritization for who should get a vaccine first. Some of these sort of overlap in certain ways. So for instance, if you both have diabetes and you work in sort of an essential job, then presumably you should be very high up on the priority list. But we made these recommendations to the CDC, and then governors did or didn't listen to the CDC. I mean, the CDC took a lot of these on board, and then what governors did just depended by state. But what I do want to say is I want to say three things that don't seem to be good. So the first is a policy of first come, first served. And the reason why I want to criticize first come, first served is that it exacerbates injustices. So, even if you make it first come, first serve for people above a certain age, like 65 plus, some people are able to wait in line for a vaccine all day. And for other people, that's not feasible because they have to work. They can't take the time off. They don't have the ability to wait in line. And so if you care about mitigating injustice, first come, first serve is not going to be a good way of actually distributing vaccines once we've decided on who's entitled to vaccines first. Second, location matters. So when Governor DeSantis decided that in Palm Beach County that Publix would be the exclusive distributor of the COVID-19 vaccine, a lot of people were sort of horrified because if you look here at where residents live and what their socioeconomic status is, you'll see that wealthier people tend to live near to Publix, and people from poorer areas and less white areas tend to live further away from Publix. And so where you sort of give out the vaccine can also exacerbate injustice. So, I've been talking a fair amount about racial injustice, specifically when it comes to this pandemic and access to the vaccine. So a really natural thought would be that perhaps we should prioritize people on the basis of race or ethnicity, and we should try to prioritize people who are at especially high risk because, say, they're Black or Latinx. We ultimately decided this would be a bad idea. And this is because of larger background injustices that have affected attitudes of people, especially Black Americans, towards medical practitioners. So on the left, this is Herman Shaw in 1997 at the White House. President Bill Clinton had just finished giving an apology for the Tuskegee syphilis experiment. Now, I'm sure many, if not most, of the people in the audience know what the Tuskegee syphilis experiment was, but just to be explicit, from 1932 to 1972, the United States Public Health Service ran this experiment. And the basic idea was they recruited Black sharecroppers from the Tuskegee area, people who didn't have much in the way of education or income, and they offered to give them meals and to help them with their quote unquote bad blood. So bad blood was a term used for syphilis in the region at the time. And rather than providing treatment in the way that they indicated they would, these researchers just basically watched as these men deteriorated from syphilis, and they just documented the effects of syphilis. This study ended in 1972 only after a whistleblower revealed what was going on, and it made national news. Now, I bring this up because, hesitancy among Black Americans is correlated with knowledge of the Tuskegee syphilis study. More generally, Black Americans they don't get access to the same quality of care, even when you can control for things like income, education, things like that. And the thought is, it's been documented pretty well before this pandemic, that vaccine hesitancy is correlated with reported experiences of racial discrimination or the belief that the medical profession is racially biased. So given all this, there's a sizable amount of distrust, both of vaccines in particular and of public health and medical practitioners more generally. Now, if that's the situation, trying to prioritize Black people for getting the first dose of vaccine seems like a terrible strategy, because it can naturally seem like we're going to treat you as basically like guinea pigs to see how this drug works out. After all, the United States has basically done this before. So our thought was that by prioritizing sort of various essential workers and people at high risk, we would manage to account for many of the injustices in question that are on the basis of race, without doing so in a way that could backfire by triggering understandable, reasonable distrust of government that has been caused by historical and ongoing injustice. So that's where we landed on this sort of first question about how to allocate vaccines. This team of epidemiologists, vaccine safety experts, and bioethicists like myself, we were focused really on this question about, given that vaccines provide protection to the recipient of the vaccine, what's the fair way to distribute this invaluable, scarce resource? But there are other questions too. And in this next part of the talk, I'm going to turn to the feature of vaccines that they provide protection to people other than the recipient. And this naturally raises the question about whether individuals, ordinary individuals like me, have a moral obligation to get vaccinated. So the basic idea, well, before I get going, I just want to clarify some terminology that I'll be using. First is moral obligation. So as I use the term, moral obligations are just requirements to do something. And if you do something, if you fail to act in accordance with your moral obligation, you do something morally wrong. Moral reasons, by contrast, are just considerations that count in favor of doing something. So if you fail to act on moral reasons, you don't necessarily do something morally wrong. Reasons are effectively weaker than moral obligations. And what I'm going to argue in this section is that while most individuals have moral reasons to get vaccinated for COVID, they currently don't have moral obligations to do so, but this will change. I'm going to suggest that hopefully soon individuals will have strict moral obligations to get vaccinated, but we're not there yet. So one really natural thought that you might put forward, a line of argument to show that individuals have an obligation to get vaccinated against COVID, would appeal to the fact that vaccines protect other individuals you encounter. So for instance, you might argue that getting vaccinated against COVID-19 exposes others to risk of harm. You're obligated to not expose others to risk of harm. So in some of the ethics literature about the existence of an obligation to get vaccinated, some people compare going unvaccinated to firing a gun in the air. Perhaps, I mean, we think it's morally inappropriate to fire a gun in the air. So presumably it's inappropriate to go unvaccinated. So you're obligated to get vaccinated because doing so will prevent you from exposing others to risk of harm. Well, there's a problem with this argument, which is that you can take other steps to prevent yourself from imposing risk on others. So if you wear a mask or socially distance, that means others aren't exposed to that much risk. So really, if we grant that you have an obligation to not expose others to risk, then this counts in favor of getting vaccinated or wearing a mask and socially distancing, et cetera. In other words, it doesn't show that this sort of appeal to your obligation not to impose risk on other people does not seem to require getting vaccinated specifically. So if you really wanted to appeal to the individual risk of harm to show that individuals have a moral obligation to get vaccinated, the argument would need to be something like this. We're obligated to not impose risk above a certain threshold. Getting vaccinated is the only way to not impose risk above that threshold. So we're obligated to get vaccinated. But I mean, we need an argument at the very least to accept one or two. So why think that going unvaccinated but wearing a mask is the only way to not risk above a threshold, and why think that that's the relevant threshold for acceptable risk imposition? Now, to be clear, you have reasons to not impose risk on others, but my claim is just that these reasons are weaker than obligations. So appealing to the individual risks you impose on other people, I think, is not going to be a strong enough sort of consideration to show that individuals have moral obligations to get vaccinated for COVID-19. Now, a really different kind of argument, one that I sort of make in some of my published work about this issue, focuses less on the individual risk of harm of going unvaccinated and more on the collective benefit of herd immunity. The basic idea is not getting vaccinated is sort of like free riding, or it's a failure to do your fair share in providing a collective benefit to the entire community. So here would be an analogy. I'm sure many of you are familiar with the tragedy of the commons, but the idea is this. You can imagine a bunch of ranchers have a patch of grass that's owned in common. They can all graze their cattle on that patch of grass sustainably. If one rancher, overgrazes their cattle, then it's fine. But if too many ranchers overgraze their cattle, then the commons is depleted and sustainable grazing is no longer possible. It's a classic collective action problem. If one person does the uncooperative behavior, it's fine. But if too many do, then we're all collectively worse off. Or to take another sort of analogy, imagine that there's a drought, and if everybody waters their lawn, then we will run out of potable water in a town. So there are mandatory water restrictions imposed to make sure that we all have access to potable water for the things we really need. In that sort of case, it seems very plausible that you have an obligation to do your fair share by complying with the water restrictions and not watering your lawn. That's doing your fair share and ensuring that we're all enjoying this collective benefit that comes with complying with the rule of mandatory water restrictions. So if we apply this to vaccination, the thought would be just as enjoying a commons that's not depleted or enjoying enough potable water, the thought would be herd immunity is a collective benefit that makes all of us better off. Or, more often people compare herd immunity to something like national defense or clean air or something like that. We all benefit from national defense or clean air, but in order to enjoy those sorts of goods, we have to have a government that gets enough tax revenue to provide them. And so you might think that just as we perhaps have obligations to, not overwater our lawns or to pay taxes, we also have obligations to get vaccinated against certain diseases. So the argument from fairness then is as follows. You're obligated to do your fair share in producing collective benefits like herd immunity. Getting vaccinated is doing your fair share in producing a collective benefit like herd immunity. So you're obligated to get vaccinated against COVID-19. Well, I don't think this argument works right now. We don't currently enjoy herd immunity, and most people haven't gotten vaccinated for COVID. So I make in some of my published work, I argue that this argument works very, very well if we're thinking about individual obligations to get your children vaccinated against measles, mumps, and rubella, because we do enjoy herd immunity for measles, mumps, and rubella. And the majority of other people are doing their fair share in producing the good of herd immunity against measles, mumps, and rubella. But for COVID, we're just not there yet. So really, the comparison would be the tragedy of the commons is well underway. So it's not that everybody else is grazing their cattle a sustainable amount. It's just that nobody is really grazing, or very few people are grazing their cattle a sustainable amount. And so when you're in conditions where the collective benefit isn't being achieved because most other people aren't behaving in the cooperative way, then this argument from fairness doesn't really work. So right now, not getting vaccinated doesn't seem to violate some sort of obligation to do your fair share. But once enough people do get vaccinated and we do start to come closer to enjoying herd immunity, then we will have obligations of fairness to get vaccinated to our fellow citizens. So what I think is probably the most accurate way to characterize our sort of moral reasoning about what we should do when it comes to getting vaccinated is that we should contribute to the emergence of herd immunity. You should be a first mover, so to speak. So the thought here is that it's not that you're just doing your fair share when lots of other people are doing their fair share. The thought is we need to get to a situation where everybody is doing their fair share, and we need a first mover to make that happen. So here are some analogies. You could be one of the first people in the previous analogies to publicly stop watering your lawn or overgrazing, because by publicly stopping watering your lawn, you're sending a signal to other people that this is the appropriate thing to do, even though you might not, even though we're not enjoying the good that comes from all of us watering our lawn the sustainable amount, you're still contributing to the state of affairs where we all do behave in the socially optimal way. Similarly, you might think that we have reasons to reduce our carbon footprints if we think that the only way to avoid terrible effects from climate change will involve many of us reducing our carbon footprints. So for instance, you might think that Americans eat on average a bit over 200 pounds of meat a year. This has a very high carbon footprint. Now, if I reduce my diet, that clearly won't make a difference as to whether climate change occurs. And similarly, it's not the case that most other people are changing their diet to promote better climate outcomes, but we might think that there's something morally worthwhile about me changing my diet to have a smaller carbon footprint, even though the majority of other people aren't doing so. I'll skip over this last example for the sake of time. So the argument from contribution is this: you have moral reasons to contribute to the emergence of collective benefits, even if most others aren't doing so. We currently aren't close to enjoying the collective benefit. Getting vaccinated will contribute to the collective benefit of herd immunity. So you have moral reasons to get vaccinated for COVID-19. But just to be clear, our reasons to contribute to the emergence of a collective benefit are far weaker than an obligation to do so. So, there's all kinds of reasons that we have to contribute to all sorts of collectively good outcomes, but that it's very different to say it would be good for you to do this thing from saying you did something wrong by failing to do it. So while you have reasons to get vaccinated for COVID, this doesn't show that refusing the COVID vaccine violates a moral obligation or you do something wrong by foregoing vaccination. So where does this leave us? I just want to recap. My take is that once a significant majority of people have been vaccinated and we enjoy herd immunity, each individual will have an obligation of fairness to get vaccinated. But until then, we just each have morally weaker reasons to not expose others to risk of harm. And we have reasons to be first movers towards achieving the collective benefit of herd immunity. Okay, so just to take a step back, we're in the home stretch. We've talked about how, given that vaccines provide protection to individual recipients of the vaccine, that raises questions about the fair allocation of vaccines. Given that vaccines provide protection to people other than the recipient of the vaccine, that leads to questions about individual obligations to get vaccinated. Now, I want to turn to this final question, questions about the appropriateness of mandates for vaccines. So, this not anti-vax, pro-choice, my body, my choice, this sort of gets at the underlying sort of tension between two kinds of values that get invoked in this debate about vaccine mandates. So on the one hand, it seems like having governments or employers require people to get the COVID-19 vaccine might seem very appealing. So doing so would surely promote public health, and it's a core function of legitimate governments that they promote public health. I mean, governments are supposed to solve collective action problems like the sort of water restriction case or the tragedy of the commons. And so, by mandating the vaccine, it would ensure that a lot of people will get vaccinated because they don't want to suffer the penalty that accompanies not getting vaccinated once a mandate's in place. And so governments would be able to accomplish this very valuable sort of task that they're supposed to perform, which is to solve a collective action problem and promote overall public health. On the other hand, mandates do this by infringing on individual liberty. And some sort of ethicists and political philosophers argue that individual liberty is the core value that outweighs all other values, broadly what I'll call libertarian sorts of views. But for people who don't endorse libertarianism, there are values other than individual liberty that really matter. And so, it's a question, so basically this concern for individual liberty doesn't show that mandates are illegitimate, but it counts against mandates. Finally, I think most relevantly for our present purposes, that even if they're ethically justifiable, legislating and enforcing a mandate for all or most adults would be quite difficult. As I noted, this was published in December, but attitudes about vaccine mandates for all adults are not as supportive as they would need to be in order for that legislation to be sort of realistic. And I take it that enforcing a mandate would be a nightmare if we have lots and lots of people who don't think that they're legitimate. So there are reasons to, before we go to a universal mandate, to look for alternative policies that increase vaccination rates. So one possibility is we think about more restricted mandates. And so people have proposed that perhaps there should be mandates for workers who are especially likely to expose others to high risk or are themselves exposed to high risk. And healthcare workers in particular seem like a great candidate for this sort of argument for a few reasons. So first, healthcare workers are exposed to high risk every day. And so if they were all required to get vaccinated, then they would presumably expose others around them to less risk, their coworkers, as well as the people who live with them. Second, healthcare workers are around vulnerable patients. If they get vaccinated, then the risk that those vulnerable patients are exposed to is decreased. And finally, we often think that healthcare workers in particular have moral obligations to vulnerable patients or even perhaps society at large during a pandemic. So as a side note, there's a really interesting debate about the obligations of healthcare workers during some sort of a public health crisis. This literature became really prominent during the HIV/AIDS epidemic in the 80s. And there's a lot of discussion about, well, healthcare workers get all these benefits. It's a high status job, high paying job. They get access to this knowledge that's collectively sort of passed down by society. They owe it to the rest of us to sort of make some sacrifices and to help us out during a pandemic. So maybe you like an argument like that. So what these considerations are supposed to indicate is that a mandate for healthcare workers might seem especially ethically appropriate. So the first argument I sort of one argument that you could make in defense of a mandate would be this: healthcare workers have a moral obligation to protect or not harm vulnerable patients, and this obligation may be enforced by the government or employers. Going unvaccinated violates this moral obligation, so governments or employers may enforce the obligation of healthcare workers to get vaccinated. Well, the problem for this is kind of one we've already seen for the argument about individual moral obligations to get vaccinated, regardless of whether you're a healthcare worker. So getting vaccinated would surely provide significant additional protection, but if healthcare workers are already required to use personal protective equipment, why think that they violate an obligation to keep patients safe if they don't go vaccinated? In other words, personal protective equipment affords significant protection to patients already, and healthcare workers are required to make use of personal protective equipment. So what we need is an argument that shows that healthcare workers need to provide additional protection to patients that goes above and beyond the use of personal protective equipment. Now, I'm not saying that this argument couldn't be made, but I think that it's not as obvious as it might seem that we shouldn't require, it's not as obvious as it might seem that we should require healthcare workers to get vaccinated, given that they can protect patients in other ways too. Similarly, the argument from fairness, we might think that healthcare workers have an obligation of fairness to the rest of society or other healthcare workers to do their part in combating the pandemic. And this obligation can be enforced in the form of a mandate by government or employers. Doing one's part to combat the pandemic requires getting vaccinated. So governments or employers may enforce the obligations of healthcare workers to get vaccinated by imposing a mandate. Well, I think it's implausible. This argument's sort of implausible because healthcare workers have already made so many sacrifices on behalf of combating the pandemic. So what you're really saying when you make this argument is you're saying that a healthcare worker who doesn't get vaccinated is failing to do their fair share in this collective endeavor to try to sort of mitigate this pandemic. But healthcare workers have taken on huge burdens during this pandemic. There seems something to be almost perverse about saying that healthcare workers who don't get vaccinated are violating an obligation of fairness to the rest of us. So I don't think that this argument really works very well for showing that there should be a mandate. A third argument comes back to some of the discussion of racial injustice and distrust. So if a mandate led hesitant Black healthcare workers to get fired or quit, that would do what I'll call compound an injustice. Because of past or ongoing injustices, these individuals be losing additional important opportunities or goods. In other words, if people have reasonable or justified distrust of vaccines because of a history of deception and mistreatment that continues in certain respects today, it seems really perverse to say that those individuals should have to lose their jobs because they are acting on the basis of that sort of distrust. And presumably, there are reasons not to compound injustices. So we want to avoid a policy that would lead to, nurses of color, for instance, to quit in larger numbers because of their sort of background distrust of vaccines because of these sorts of historical and ongoing injustices. So where does this leave mandates? I mean, I think that there are real ethical concerns about vaccine mandates for healthcare workers, but I mean, clearly mandating a vaccine for healthcare workers would provide significant protection to patients and society. And I could see somebody making the case that even though these concerns about these other arguments aren't working, just look, this is a no-brainer. This benefits society overall, we should do it. I could see somebody making that case. That said, I think it's worth considering whether there are other measures that could increase vaccination rates among healthcare workers before we resort to the mandate. So the mandate's always there. It's sort of the ultimate sort of tool that we have to get people vaccinated. But there are other things that governments can do to get people to get vaccinated. So, for instance, some nurses report that they aren't getting vaccinated because they just don't have enough time off from work, or they don't have childcare. So they're overworked and they don't have time to go get vaccinated, basically. If we want healthcare workers to get vaccinated in large numbers, then it seems like an obvious solution would be to try to ensure that they get more time off from work, or we provide childcare for them or something like that. Another sort of thing that's been explored more generally when thinking about alternatives to vaccine mandates are sort of opt-in versus opt-out or choice architecture, what's popularly called nudging. So, I mean, this is kind of depressing when you think about it, but in Michigan, they have explored, instead of using a mandate for children when it comes to the measles, mumps, rubella vaccine, instead of saying either your child has to get vaccinated or they can't go to public school, instead, the policy is either your child has to get vaccinated or you have to attend a bunch of vaccine safety classes so you can learn about how vaccines work. And if you still have reservations about the safety of vaccines, at the end of that class, you may opt out of getting your child vaccinated. Vaccination rates are pretty high in Michigan. I mean, that policy seems to have worked really well, which, if you think about it, is kind of like disturbing, because it means that parents who are convinced that vaccines cause autism, they care, like, they would rather risk their child getting autism than attend these vaccine safety classes. I mean, I guess that's one way to interpret it. But anyway, we could imagine sort of various kinds of choice architecture where nurses or other healthcare workers are they are signed up to get vaccinated and they can opt out potentially, rather than saying either you get vaccinated or you get fired. So, I gave you sort of 3 different sorts of topics that I've been working on and thinking about, trading a little bit of breadth for shallowness, but I'm going to sort of just give some general takeaways. The first is that when it comes to allocation and justice, the scarcity of vaccine leads to questions of justice for allocation, especially given that lots of people want to get vaccinated and there's just not enough to go around. There are further questions of justice that emerge because the pandemic has not affected all of us equally. Some of us are at higher risk than others from COVID-19 itself, and some of us working from home is more feasible for some of us than others. Moreover, when thinking about allocation, access to and attitudes about vaccines are affected by past and ongoing injustices. Now, these questions about allocation and justice will hopefully start to fade as more and more people get vaccinated. And we should be thinking, hopefully soon, we'll be thinking a lot more about whether individuals have a moral obligation to get vaccinated, given that doing so is going to be a vital tool in ending this pandemic. And it will save lives even before we end the pandemic. Now, I want to say that that the strongest case for an obligation to get vaccinated against COVID is the sort of argument from fairness, that you have an obligation to do your fair share in supplying the sort of public good of herd immunity. But that means that, whether we have that obligation will be sensitive to how many other people are getting vaccinated. So right now, not enough other people are getting vaccinated for us to have this individual obligation of fairness. But as the pandemic progresses, we will get to the point where hopefully we will get to the point where enough people have gotten vaccinated, and then you will have the obligation of fairness. In the meantime, there's still very good moral reasons to get vaccinated, but it's not as though people who are not sure whether to get vaccinated now are doing something that's, strictly speaking, morally wrong. Finally, mandates. Again, I want to emphasize that mandates would presumably be very beneficial for patient health and for public health generally, but there are at least some reasons to explore alternatives before resorting to the sort of heavy-handed mandate. So I mentioned some of those possible alternatives. Now, I should mention that, these are just a few of the topics that I've been thinking about recently, but there are a lot of other ones that are coming up. There are a lot of other ones that have already happened. One I'll just briefly mention is a question about vaccine passports. So are we going to start allowing people in society to have access to certain sorts of goods or services on the condition that they've gotten a vaccine? That gets into these questions about the ethical appropriateness of mandates, and it will intersect with some of the issues I brought up today. But I guess, for now, I'm just going to leave it with what I've talked about. So feel free to email me with any questions or comments. And in case you're curious, here are some of the things I've published recently about vaccination ethics during the pandemic.
Thank you, Justin. Just as a reminder, if you have a question for our speaker today, please use the Q&A button in the bottom of your screen and type your question there. We will try to go through as many questions as we can in the remainder of our time. And if we don't get through all the questions, we will ask our speaker to answer it offline. And we will post the answer together with a recording of the presentation on our website, which is FAU Research in Action. If you Google that, you should find that. So you already started answering a little bit our first question here, Justin, which is actually related to these kind of passports, like the vaccination cards that are being given out currently for when you get your COVID vaccine. Can you talk a little bit more on your thoughts of whether or not government or private services should be using these passports or vaccination cards?
Yeah. So, I mean, some of the things I've said already, they have some relatively straightforward implications for vaccine passports. So, as I've mentioned, people have vaccine hesitancy because of historical or ongoing injustice. Depriving them of various other opportunities is worrisome. Now, that's not to say that that worry can't be overcome. We might think that the public health benefits are so great that it's all things considered justified to require people to do that. I just think we should be, at the very least, we should be aware that it has these sorts of costs as well. Yeah, I think I'll leave it at that.
Thanks. So several of our questions are related to the current difference in vaccine that is specific to COVID, right? At least two of the current vaccines that are available have used newer technology. And some of our attendees are, mentioning that this is still in a research phase, the vaccine. It could be viewed as being still in a research phase. And if you look at the media outlets, there are a lot of descriptions of potential side effects yet, and those kind of news articles, right, that we're reading continuously on. How does that factor into these decisions that you're talking about, that we are having at least two vaccines that are based on newer technologies that are not quite as developed as older vaccines that are using different technology?
Good. Okay. I'm going to say a few things about that. So the first is that I think that's a point that I didn't make, but I was thinking about making when thinking about mandates. So right now we are in a phase of emergency use authorization by the FDA. That suggests that I take it that a mandate would be more justifiable once we get past the emergency use authorization phase. So when there are certain unknowns about the vaccine, I think that makes it more justifiable. It makes it harder to justify a mandate, and it counts against the existence of an obligation to get vaccinated. That said, I mean, there have been extensive trials, and there's really not much evidence of longer term adverse side effects. So I don't want to play into certain misinformation that's being spread about these vaccines. But at the same time, I think that's a real concern, and it complicates both arguments in favor of a mandate and arguments in defense of the existence of a moral obligation to get vaccinated.
Great. And I just want to mention for our attendees, if you have any medical questions related to these vaccines, please contact us. We do have an expert here on campus who can answer those more medically related questions that are specific to the type of vaccines that are being given out at the moment. Coming back to the potential obligation that people might feel to get vaccinated, here's another question from a leader in a community. Let's say somebody in clergy or an elder or an elected official, for example. How would you view the ethical obligation to be for a person in those kind of roles to get vaccinated first, particularly if the constituents include people that are hesitant to get vaccinated?
Yeah, that's a great question. I guess, yeah, so I was thinking about the obligation for quote unquote ordinary individuals. If you have the ability to have significant influence on other people, then I would think that, I mean, the way I would analyze it is still in terms of the sort of reasons to contribute to a good outcome. It just so happens that people in those sorts of roles are in a position where they can make a larger contribution than you or me. So if I get vaccinated and I post it on Facebook, that's not going to have the same sort of impact as a leader of a church with like 4,000 members or whatever who gets vaccinated publicly. So I think that it's that much better, and it's great for them to do so. I'm hesitant to say that they are, strictly speaking, obligated to do that, partly because we could imagine lots of different things that these leaders could be doing to advance the cause of various worthwhile collective goods. But I will say, yeah, I mean, I think that, so for instance, in the NBA, Kareem Abdul-Jabbar and Greg Popovich are publicly getting vaccinated and sort of public service announcements. And I think that that's very laudatory. I guess I'm hesitant to say that if they refrain to do that, that they're violating some sort of moral obligation to the rest of us.
Right, you have to spin it both ways,
Yeah,
right? What if they don't get it?
right.
Okay, so our next question here comes relates the COVID virus to what happened with HIV and the spread of HIV. And some people there have had sued others for intentional spread of the deadly disease. Do you expect that this is going to happen with COVID as well?
Yeah, that's a great question. I'm not a lawyer, so I feel a little bit uneasy weighing in on that. But I mean, I could imagine that, yeah, we'll start to see cases about that sort of thing. I mean, it's kind of, so I have friends who are lawyers who work on this sort of topic, and it's a crazy time because like, so the legal precedent for like vaccine mandates really all goes back to a 1905 case, Jacobson versus Massachusetts, where a man who didn't want to get vaccinated for smallpox was fined like $5. And so courts have appealed to that again and again. That seems like a pretty thin precedent to hang massive policies on. So I think I mean, that's all just to illustrate that we're sort of in the Wild West here. I think we're going to see, I mean, maybe we will see appeals to intentionally or knowingly spreading HIV as we get further along and further removed from the situation where it seems like we all could be spreading COVID without really knowing. So as it becomes more reasonable to expect people to foresee and take the relevant cautions, I would imagine we'll start to see cases like that.
Interesting times for
Yeah.
sure. Okay, you talked about herd immunity earlier. So here's a question: since a greater amount of people getting the vaccine would get us to herd immunity, and would that then create a moral obligation for all to contribute? Because just the fact that it gets us to herd immunity then creates that kind of like a backfire, if you like, to, you have to get vaccinated to reach that herd immunity.
Yeah. So, I mean, I guess maybe I'll just take this as a chance to elaborate on the sort of fairness argument I was sort of making. So, my claim is that imagine that the tragedy of the commons is really well underway, or most people are overgrazing their cattle. It seems implausible to me that you have a strong moral obligation to graze your cattle the sustainable amount when the majority of other people aren't doing so. So when it comes to the provision of a collective benefit like herd immunity, I think it's very plausible that you have a strong obligation to comply with the collectively beneficial rule when most other people are complying. But if we're in conditions of non-compliance or non-cooperation, those sorts of fairness arguments are far less plausible. In other words, why should you be the only sucker who undergrazes their cattle when everybody else is overgrazing it, right? So why should you cooperate when everybody else is defecting? So I think that for that reason, I'm not that convinced. I mean, clearly, we all want to have herd immunity. It's a collective benefit, but it's also sort of a collective action problem, right? So we need to have enough people to get on board in order for us to get that collective benefit. Once we do have enough people on board, then the obligation of fairness kicks in. But until then, you just sort of have reasons to contribute. You have reasons to be the first mover in the same way that we have reasons to be the first mover with a host of other cases where we don't currently enjoy the collective benefit, but ideally we would. And we need lots of people to sort of coordinate and cooperate in order to get that collective benefit.
Thanks. Coming back, we said earlier that the current vaccines are all under an emergency use approval. Do you think there's a difference between mandating a fully authorized vaccine versus one that's under emergency use approval?
Yes, I thought I said that really briefly. I don't have too much to add about it, but yeah, I'd say that there's a significant difference between requiring people to get a vaccine that's been around for a while, doesn't use new technology, and we know more about the longer term side effects, and something where it's not as well established. So I think that, I mean, I'm very confident that there will be few to no, like very, very, very few cases of long-term adverse side effects. If anything, I should note that lots and lots of people are saying that we're being overly cautious in rolling out the vaccines. But I agree that requiring people to take a drug where it's only authorized for emergency use, that is morally dicier than requiring people to take a vaccine that has, been tried and tested and it's been around for a long time, like the measles, mumps, rubella vaccine.
Okay, coming back to the controversy behind all the vaccinations and the mandate for it, there's an overarching question here. Have there been other vaccines that experienced this much controversy or hesitancy during the initial implementation?
Oh, yeah. So every vaccine that's ever been developed has encountered huge resistance at the beginning. So I think Paul Offit has a book that sort of details the history of vaccine opposition. And it's like you get like in the 18th century when the smallpox vaccines developed, you get these pamphlets saying like, if you take this vaccine, you'll grow horns. And it's like crazy stuff like that. But yeah, I mean, the anti-vax movement is still alive and well when it comes to measles, mumps, and rubella. It was much more active earlier when the measles, mumps, rubella vaccine was sort of being developed. I think that this case is really interesting because there are some people, you might call them like diehard anti-vaxxers. They're going to be opposed no matter what the vaccine is, no matter how long it is around. What makes this case interesting is that you have a lot of people who are ordinarily very receptive to different vaccines, like people who are willing to get the flu shot, who are a little bit nervous about this one just because it hasn't been around as long. I'm cautiously optimistic that as time goes on and the number of people who get vaccinated and where there aren't really any adverse side effects, as that goes on, those people will buy into getting vaccinated. But I think that there will still be sort of holdouts. The other thing that I think is really interesting about this case, I mean, I'm not a political scientist, but it seems like we are in an especially polarized time where people's attitudes about the vaccine are increasingly tied up with their political identities. So, for instance, Vice President Harris, during the vice presidential debate, said that she would only take the vaccine when the FDA recommended it, not if just Trump recommended it. I mean, on the one hand, that makes a lot of sense. On the other hand, that says a lot, that she's basically saying, I don't trust this administration's motives in recommending the vaccine. Conversely, you're going to have a lot of people who are Republicans who don't trust this current administration and they won't want to get vaccinated. So I think that polarization is sort of an element in that sort of hesitancy story that's especially pronounced this time. And it's worrisome, but it'll be interesting to see how it plays out.
Yeah, definitely interesting times. So you mentioned in your presentation the inoculation disparities.
Mm-hmm.
Now it has been announced that next week vaccinations are opening up for everybody 18 and older.
Yeah.
Do you believe that that will lead to greater inoculation disparities? You mentioned that, for example, the publics are more in affluent areas. So what's your expectation there?
That's a really good question. I don't know enough about Florida demographics to know, so whether there are these disparities will depend on the percentage of different age groups that are made up of different ethnic and racial backgrounds, for instance. So I can't responsibly answer that question. I think it's a really good question. I think it's something that we should definitely be looking for in advance, and we should be taking steps to avoid the sort of problematic aspects of the rollout for older age groups.
Yeah, definitely. Here's a really interesting question, I believe. We don't really know yet how long the current vaccines are good for, right? How long your immunity is. I think today or yesterday in the news, there was an article that Pfizer was saying that theirs is at least 6 months, provides 6-month immunity. Now that poses the question, what happens with revaccination and where do the moral obligations come in once you are vaccinated and you may need to get a booster in 6 months or something like that? Where do you see the moral obligations there?
Yeah, that's a great question. I mean, I would think, the analysis I provided would apply at re-upping as well. So I would think that once we have a lot of people who've gotten vaccinated, but we're enjoying the sort of good of herd immunity, if that good becomes endangered by people not wanting to get revaccinated, like getting the re-up, getting the booster shot, then if we have enough people who are getting vaccinated, then the obligation of fairness still applies. So for instance, measles, mumps, rubella, we're at risk sometimes of falling below the 95% threshold for herd immunity. If we find that we're in danger of falling below the threshold, I still think we have that obligation of fairness to get vaccinated. If everybody as a society collectively says we're not willing to get revaccinated, then I think we're in that space of moral reasons to contribute to a collective benefit rather than an obligation of fairness to ensure we maintain that collective benefit that we enjoy, doing our fair share when lots of other people are cooperating. So I think it's the same sort of analysis that's going to apply there, but I think that it's going to be a real test of our commitment to beating this pandemic, whether people are willing to keep getting vaccinated as often as they need to. So, I mean, one comparison would be flu vaccination. Each year, about, I think it's like 42 to 45% of adults get vaccinated for flu. I mean, if we got more people to get vaccinated for flu every year, we could enjoy herd immunity against flu every year. We just don't seem to have the political will or the commitment to getting herd immunity for flu each year. Hopefully we have the political will when it comes to this disease, but who knows?
Okay, we're almost out of time. I'm going to ask one more question. I know we have a number of questions left here. So what we are going to ask you, Justin, to answer those offline. We will post the answers together with a recording of your presentation on our website. It is FAU Division of Research. If you Google Research in Action, it should come up. You can find it there in a couple of days or so. And also want to remind our attendees that if you have medically oriented questions, we do have personnel, we have faculty on campus who have specific knowledge in that area. Please contact us. You will find the link to our email as well on that website. Okay, here's the last question of the day. So the current vaccines have been published with different efficacies, each one of them, right? And there are updates on that continuously, it seems. Is there a moral or ethical obligation to use one versus the other?
I mean, this is so it's good that you preface this with the medical question should go to other people. So again, I'm a philosopher by training. I hang out with epidemiologists, but I'm not an epidemiologist. So I am hesitant to say too much about that. I mean, my sense is even the least effective, the Johnson and Johnson, is quite effective. And so, and also I don't think that, I mean, in many cases, it's not feasible for us to sort of shop around. So in many cases, you get Pfizer, you don't get to vaccine shop. And there are reasons to think that they're reserving Johnson & Johnson for people who might be less able to come back or less likely to come back for a second appointment. So I think those sorts of considerations would need to play into it, but I'd be skeptical if someone were to argue you have an obligation to try to get the most effective vaccine possible. I think that these vaccines are all quite good. And so long as you're getting an effective one, I think that that's probably good enough. Like, so this gets back into we have obligations not to expose people to some degree of risk, but do we really think that we have an obligation to minimize the risk we impose on other people? And that seems implausible. We tolerate all kinds of risk imposition in all other sorts of contexts.
Right. And again, if you have questions how these vaccines were actually tested, they were all tested differently, and that accounts for their published efficacy, please contact us. We'll get you in touch with our medical faculty, and they can answer those questions directly. With that, thank you very much, Justin. We will have you answer the remaining questions and post the answers on our website together with a recording. Thank you very much for calling in, and we hope to see you next week again. Thanks again.
So much.
Bye-bye.